Hello, everyone. This is Ken Baliar from SleepGeeks.com. Sleep Geeks, place where sleep techs go and learn. This is not about Chat GPT or AI. This is about learning from other sleep techs like myself. I've been a sleep tech for 25 years and now trying to spread what I have learned throughout the years. Especially sleep technology is a very technical field, meaning to say, you can't just learn things from reading, right? There are going to be a lot of experience involved in becoming a better one. Everything can be learned, but to be better at it, it requires insights, experience, and the sharing of best practices. Anyway, moving forward, this message is meant for Filipinos who are currently sleep techs that want to pursue becoming an RPSGT. So what is an RPSGT? You may ask. RPSGT is the license that is accepted globally. Yes, you heard that, globally, all throughout the world. They will accept your license as RPSGT to become their sleep technician or technologist for the sleep labs. This is applicable to countries such as Canada, UAE, Middle East or KSA, Qatar, New Zealand, Australia, Singapore, Malaysia, Thailand. So you can use the RPSGT licensure to promote yourself and get the job because you are a qualified sleep technologist. Now, if you're from the Philippines, how can you become an RPSGT? Based on the qualifications from BRPT.org, that's the Board of Registered Polysomnographic Technologists website that produces these exams and these licenses. There are pathways in becoming an RPSGT. There are 5. And number 5 is the international pathway, meaning to say those technicians that have clinical backgrounds, okay, and they have experience working as a sleep tech, accumulating at least the minimum of 960 hours, meaning to say you've been a sleep tech working for a year or 2, depends on how busy your lab is, and if you are full-time or part-time or per diem. So you can accumulate quicker if you're full-time and your lab is hustling and bustling, having a lot of patients. If your lab is small, there are labs in the Philippines with only 1 bed and are not always booked. So it might take you a while before you accumulate 960 hours. But once you do, you need to create an account in the BRPT website. This is where you're going to be registering and sending your application to take the exam. They are the ones giving you the license. So once you do open an account, you have to fill out everything they ask for, but you also have to provide your current BLS card. And it should be American Heart Association, BLS. At least that's to my understanding and experience. Now, the other thing you need is, of course, your transcripts or your diploma showing that you have a medical background. Maybe you're a nurse, a med tech, a respiratory therapist, physical therapist, a psychologist, rad tech, etc. Once you have that transcript or diploma, you need to send a letter stating the hours that you have accumulated. So this shows and proves that you have reached at least 960 hours of tech work. This can be signed by your medical director, your supervisor, manager, or your HR, human resources department. Now, once you have that, you also pay for the examination, which is now at $550. That's USD. So it's a lot of money. Okay. You can apply and get approved, meaning that you can schedule your exam. It doesn't have to be scheduled immediately. You can delay it for a few months, and I'll update this video to see if it was 3 or 6 months. What you can do then is, since you have the hours and all the qualification, you just need now the review. I can guide you through review. I'll create a different video to highlight the things that you need to study. Or you can sit in my class. I do teach online once or twice a week for our PSGT reviewers. What happens next is that when you finish the review, it's better that you take the test as soon as you're done with the review, at least within 2 weeks. This way, you still have the materials fresh in your head, in your memory. I will teach you some of the techniques in keeping these information in your brain. Okay? I don't teach to just take the test. I teach for you to improve your skills. So with that said, now that you understand the documentations, the next video will be on what to study. I'll see you then. Don't forget to like and subscribe for sleepgeeks.com.